Today's episode is brought to you by our amazing friends at Picmonic. On their behalf, I hope you enjoy. Welcome everyone to the MEDspiration podcast. I'm your host, Dr. Nav Badesha, and this is episode number 6 with Dr. Ali Haider.
Cocaine is a hell of a drug.
I said, goddamn.
According to data from the 2011 Drug Abuse Warning Network, cocaine was involved in over 500,000 of the nearly 1.3 million drug-related ER visits. That's about 1 in every 3 visits that are related to drugs. In the last 9 years, the number of people transported to the ER annually for medical emergencies caused or exacerbated by alcohol increased from about 3 million to 5 million. Of all these admissions, the CDC estimated that over 70,000 individuals died of drug overdoses in 2017. That was an all-time high in US history. Bringing our awareness and attention to these numbers can't come at a more important time. That's why today we're going to be looking at things from the perspective of a board-certified interventional cardiologist. Everything that we just discussed meets at the heart. Heart disease is the number 1 cause of death in the United States, and in this podcast with Dr. Haider, we literally talk about everything related to the health of the human heart. I learned so much about how these drugs can go on to affect our heart in the short term and in the long term. We go on to discuss the latest in heart-healthy diets and even connect emotional intelligence, mental health, and heart health. I can't really say enough great things about this guy. He really blew my mind. Dr. Haider is also a master educator on Instagram, so if you don't follow him already, make sure you check out his page. It's at Your Heart Doc. I'll be sure to leave a link in the description below. I'm checking his stuff out on the daily, and it really helps me stay up to date on the newest and coolest things in cardiology, so I definitely recommend checking that out. For those of you who haven't heard of Dr. Ali before, he's an assistant professor of medicine at Tufts University Medical School. He's board certified in internal medicine, cardiovascular disease, echocardiography, nuclear cardiology, interventional cardiology, and vascular ultrasound. That's basically another way of saying that he's a master of his craft and very well versed in all aspects of cardiology. Be sure to let us know what you guys think about our podcast. If you guys have been enjoying this content, please rate it 5 stars on iTunes. It would mean the world to us. Remember that you guys can send us a message on Instagram or tag MEDspiration in your stories. If you take a screenshot of this podcast and upload it into your stories, we'll share your story and start a conversation with you. So definitely feel free to reach out, guys. Let us know that you're out there and that you're listening. And a special thank you to our sponsor today, Picmonic. I personally use Picmonic in my studies for Step 1 directly off of my iPhone. Their learning system powers thousands of mnemonic videos and quizzes that have been scientifically proven to increase long-term memory retention by up to 331%. And trust me, they're not lying. There was things on the USMLEs that I would have never remembered if I didn't remember the Picmonic. It sounds crazy, but it's kind of like Cliff Notes meets Saturday morning cartoons for higher education. They help med students, NPs, PAs, Pharm Ds, RNs, LPNs, paramedics, and premed students rock their course exams, boards, and become more competent healthcare providers. Picmonic has partnered with MEDspiration to help make learning and memorizing easier than ever. So I know the CEO personally, and we got you a pretty sweet deal here. So you could check them out for free. If you sign up, you'll get instant access to a free video and quiz every day, no credit card required. You can use the promo code MEDspiration for 20% off any premium subscription. Again, guys, I would really recommend checking them out and trying out their resources. I promise you won't be disappointed. We'll have a link provided to you in the description below. And without further ado, let the MEDspiration begin.
Some people graduated to powder. I dabbled later, I doubt it. My database on narcotics is growing long.
Well, that shit shocks your central nervous system. There was times I did cocaine that was like electric. It was like when you put that thing in your hand.
Cocaine is acting on the beta receptors and the alpha receptors that are in your heart, in your blood vessels, how your neurotransmitters are firing. You get a surge of hyper-awareness. You get a surge of, almost jittery type of sensation.
But that now I'm older, I love you because you my friend. Without the drugs, I want you to be comfortable in your skin.
Okay. Do you want to play what? Okay. Say hello to my little friend.
I don't know if I control this feeling, and I control it.
Cocaine can also increase inflammation in the blood vessels. It'll increase the reactivity of your platelets and increase the reactivity of your clotting cascade. So that can actually cause spontaneous clot formation within the heart artery, which will subsequently lead to a heart attack. But alcohol can have direct effect on the cardiac myocyte.
Who have heart attacks these days are much less likely to die if they seek medical attention.
But if you down to try it, I know of a better way.
Dr. Ali Haider, welcome to the MEDspiration podcast. Ladies and gentlemen, today we're going to be having a conversation with a doctor who is one of my MEDspirations in life. He's a board-certified interventional cardiologist and a bona fide badass on social media, especially for us medical nerds. Dr. Haider, will you please give us an introduction to our audience and tell them a little bit about your background?
Sure. So as you said, I'm an interventional cardiologist, which basically means I do cardiology, and in addition to that, I do procedures. So I'm kind of a clinical cardiologist, but I did additional training to be able to do minimally invasive procedures where we do things like angioplasties and stent placements into heart. This also includes other things such as inserting minimally invasive valve replacements. We work on arteries and, we're cardiovascular, so I do a lot of vascular stuff. We work on the arteries and the veins of the body as well, kind of all over. In addition to just, taking care of patients' risk factors and regular medical cardiac issues. Originally from New Jersey, I work in Massachusetts now. To get to where I am, it was 4 years of college, a year of research, 4 more years of med school, 3 more years of residency, 3 years of fellowship, and 1 more year of super fellowship. So, it was a trek to get to where I am.
I was going to ask that. A lot of our followers, and they wanted to know how much schooling it really takes. And, I had some med schoolers who were like, hey, can I specialize in cardiology? Do I do internal medicine? So what did you end up doing? Did you do internal medicine as a residency?
Yeah. So to get into cardiology, you basically have to do internal medicine for, your 3 year of internal medicine. And after that, you got to apply and get into a cardiology fellowship. Some people do an additional chief year, so that's a 4th year of internal medicine to help their applications. Different than, a lot of people ask me about cardiac surgery. That's completely different. So people who do cardiothoracic surgery, stuff like open heart stuff, bypass surgeries, they go through the surgical route. So they're going to do 5 years of general surgery followed by another 2 years of cardiac surgery. Of course, now there's bit of overlap and gray zones in the world these days between interventional and cardiac surgery. But again, those are 2 independent pathways. I am, essentially a medical physician who's trained in procedures. Yeah.
My intention today is to discuss topics related to the health of the human heart. This is going to include cocaine and alcohol use, heart-healthy diets, intermittent fasting, veganism, vegetarians versus meat eaters, blood pressure. We'll get into emotional intelligence and heart health, heart disease. And then we'll get into the questions that our audience asked on Instagram. So without further ado, let's just jump straight into the deep end.
Okay.
All right. So we had 36 separate mentions on the topic of cocaine and heart health yesterday. So
Okay.
It's safe to say that our followers are dying to know all the different effects cocaine can have on the heart. So I figure we do a clinical scenario for them out there, right?
Yeah, totally.
A future patient of yours is at a party and he's with all of his boys. They're drinking, they're having a good time. And then, there's one guy in the back. He's like, yo, guys, I got some blow. Who's trying to do these lines? Right. So they go upstairs. They sneak into this room and one by one, they start snorting lines of cocaine. Can you explain to our audience what happens physiologically in the body of someone who does this?
Sure. We'll touch on 2 things. What's going on in the acute phase. So when someone, let's say it's the first time you even did cocaine, versus somebody who does it all the time. There's these effects that happen immediately on the body, and then there's also some additive long-term effects, right? It's a sympathetic adrenergic surge, right? So how your neurotransmitters are firing, that's because when people take it, they get this high, they get this sense of they have a positive energy, they feel like they can do anything, and they get this surge, right? And the same things that are happening in their mind is also happening in their organs, especially their heart. So a couple of things that happen relatively quickly is your heart rate goes up, your blood pressure goes up, right? So cocaine is acting on the beta receptors and the alpha receptors that are in your heart, in your blood vessels, that normally you would think is almost like a fight or flight response, like when you get scared or you get a surge of hyper awareness, you get a surge of almost jittery type of sensations. And what cocaine is doing is kind of capitalizing on those receptors, right? So it's making your heart rate go fast, driving your blood pressure up. It's also acting directly on your arteries, right? So your arteries have these same receptors. Part of the way it raises the blood pressure, these arteries will constrict, right? So your arteries are muscle lined, so they're going to have the ability to relax and they're going to have the ability to constrict. On the heart, it's going to increase your heart rate. It's going to increase the force of your contraction. In the blood vessels, it's going to cause them to contract, and it's going to raise your blood pressure. And this is kind of a cyclical effect. So that's kind of the immediate effect. And those same effects can be deleterious. Those same effects on the heart, even if, for example, nobody's ever done a line before, you can't really predict how each person is going to respond. So if someone has a huge surge of those receptor response, you can cause severe constriction of one of your arteries of your heart to the point where it shuts down completely, causing chest pain and even leading to a heart attack. By the same way where you're making your heart squeeze harder and work harder, it's increasing the heart's need for oxygen. We call oxygen supply mismatch, and that's going to cause potentially your heart to sort of burn some rubber, and it can kind of cause a heart attack or some injury in those situations. So,
according to the American Heart Association, during the first hour after cocaine use, the user's risk of a heart attack, it increases nearly 24 times, right? So why does that happen exactly?
It's within the first hour because, cocaine's a very fast acting drug, right? So especially when someone's snorting it versus, ingesting it, it's going straight into the bloodstream relatively quickly. So within that first hour is when the levels are the highest, right? You got buddies who can down 8 drinks and they're fine. You got someone who can down half a glass of wine and they're completely gone. Yep. Cocaine's no different, right? Everybody's going to have a different tolerance level, each body. So if somebody's more susceptible to the effects of that, they're going to have a more severe response to the cocaine effects on the heart. And just those things that I discussed and talked about, most commonly what happens in that first hour when you're talking about someone who has a heart attack is something called vasospasm. Majority of the heart attacks related to cocaine are vasospasm, which means the arteries that are supplying the heart, the coronary arteries, again, by that same reason that I mentioned, they're clamping down. And when they clamp down from the effects of the cocaine, that reduces the blood flow to the heart, and that will lead to a heart muscle injury or a heart attack. It can also precipitate a traditional heart attack. Traditional heart attack meaning you develop a blood clot in the artery of the heart, right? So cocaine can also increase inflammation in the blood vessels. It'll increase the reactivity of your platelets and increase the reactivity of your clotting cascade. So that can actually cause spontaneous clot formation within the heart artery, which will subsequently lead to a heart attack.
Okay, so let's see if I got this right. It's correct to assume that when one ingests cocaine, the heart rate rises, but the vessels, they constrict, right? So basically the demand of oxygen is higher for the heart, but it's receiving less blood, right?
Exactly right.
Okay.
So you got that right. So it's needing more oxygen, the demand is higher, but the supply is lower.
Okay, and then you combine that with the prothrombotic state, and it could cause a heart attack. But then, so is this the same reason why you get a dilated cardiomyopathy? Is it like a chronic cocaine abuser, chronic ischemia that leads to the heart kind of dilating, or how's that work?
It's a good question. The answer is actually it can do both of those things, right? So you can have habitual users, chronic use that leads to kind of chronic ischemia, microvasculature ischemia. So you can imagine this affecting sometimes the microscopic blood vessels. And over time, that can cause inflammation, injury to the heart muscle by way of affecting the blood and oxygen supply, which can lead to either over time kind of additive small heart attacks and dilated heart muscle. But cocaine can also have a direct effect on the muscle of the heart. So, this is a little less common, but it's been described. It affects somehow, again, poorly understood, but, probably due to inflammation, free radical formation, and having direct negative effects on the cardiac myocyte itself. That can lead to a dysfunctional dilated cardiomyopathy, as you pointed out, completely independent of ischemia. Yeah.
Wow.
Crazy stuff, man. Yeah.
That's crazy. So data from the 2011 Drug Abuse Warning Network, it reported that cocaine was involved in over 500,000 of nearly 1.3 million visits to the emergency department. So,
wow.
Yeah, that means 1 in 3 drug-related ER visits are from cocaine. So, for anybody out there, think twice. Think twice.
Yeah. I just posted a story recently on my Instagram. It was I don't know if you saw that. It was a couple of weeks ago about a case that I had. A guy, young guy came in. He did a rail of coke from the weekend, and then he came in. He had an inferior STEMI, included his right coronary artery. We had to go in, you open him up, he got a stent, and so had to read him the Riot Act. Otherwise, healthy 30-something-year-old dude. Most people, you think, everyone's doing it. I don't know how many 10 million people have kind of used cocaine at some point. I think the number, I don't know what exactly the numbers are in the United States. It's crazy. Obviously not everyone's going to have a problem, but you can never predict. I saw cases of people who were like, I don't do that stuff. My friend was partying. I said I tried, and boom, he's the unlucky son of a bitch that happened to, So. Dude,
that happened to Len Bias, the basketball player. Like before he entered the NBA, he did a line.
Oh, is that right?
He died before he even entered the NBA. It was like on the day he found out, and it was just
wow.
It's a famous story, but very unfortunate stuff right there. On to the next drug, though. So I wanted to discuss alcohol use, right?
Oh, yes.
That's even bigger, if anything, right? So how does the abuse of alcohol affect the heart?
The alcohol is a tricky one because you'll hear things that maybe a little bit of alcohol is beneficial to you, right? And then you hear things that how too much alcohol is negative to you, right? And that data is even out there, especially even in the Mediterranean diet, which we may talk about a little bit later, that advocates a glass of wine here and there as a part of it, and there are thoughts that in moderation, 1 to 2 drinks a day, females half to 1 drink a day kind of thing, maybe that would reduce your risk of heart disease and stroke over the long run. And again, so there is some potential data to suggest that, but by the same accord, alcohol obviously has severely deleterious effects on a lot of organs, including the heart, right? So when we talk about alcohol effects on the heart, used in excess, this can cause an alcoholic dilated cardiomyopathy. So basically, you're developing congestive heart failure and enlarged heart and the cardiomyopathy with a reduction in your ejection fraction in person who is chronic alcohol user or abuser. But alcohol can have direct effect on the cardiac myocyte, okay? I think maybe it's related to how ATP is produced or the cellular transport. So really on a cellular level of the functioning of the cells, and it is dose dependent. So, the more alcohol you use, the more likelihood that you could be susceptible to this. And that can lead people to get, very sick and have pretty advanced congestive heart failure. And again, obviously it doesn't happen to everybody. We all probably know people who are drinking a lot and nothing happens to them, kind of genetic predisposition. This can cause someone to have a dilated cardiomyopathy.
Wow. So I know alcohol, it's a suppressant, right? And say I'm drinking alcohol, like it slows down my heart rate. Is it correct to assume that?
Yeah, it's dose dependent, right? So in smaller doses, yes, it may lower your blood pressure a little bit. It may relax your heart rate a little bit. But in the higher doses, consumed too much, it actually will raise the blood pressure and it can kind of have a contradictory effect. Like it's kind of like any medication. If you think of a medication, you think about the therapeutic window you have, right? And when you have too much of a certain medication, you're going to have side effects.
What's holiday heart syndrome?
Holiday heart syndrome, right? So holiday heart so this is another effect. So, one thing is we talked about how chronic heavy alcohol use can cause heart muscle weakness, but you can also have alcohol affecting the heart arrhythmias, all right? So it can affect the electrical system of the heart. So holiday heart basically means classically in the setting of a binge session, right? So you don't even have to be a chronic user. You could be somebody who graduated from school and, had a binge session of alcohol, and then the next day you will develop atrial fibrillation. So that's exactly what holiday heart is. It's atrial arrhythmias, basically AFib, that is caused by a binge alcohol session. It can happen to any healthy. In fact, this mostly you see in younger people. Oftentimes it's self-limiting. It can go away on its own, but it's very well described and with heavy alcohol binge sessions. Yeah.
I had a really simple understanding of it. The way I thought, and you could correct me if I'm wrong. So I just figured alcohol is a suppressant. When I drink, it might suppress but you said chronic alcohol, it might not. And then what I figured is like the next day, one thing I noticed is when I check patients' blood pressures, like the night after drinking, their blood pressure is higher, their heart rate's higher, right? And I figured that, maybe alcohol, like the next day you get this rebound hypertension and this rebound increase in heart rate, and maybe that will kind of influence the atrial fib and causing holiday heart.
Yeah, and oftentimes you'll see it the following day. And why is that? Why is that? Because what happens when you're binge drinking or you're drinking the next day, what's happening? Your body wants more. It's withdrawal, right? So that's kind of acute withdrawal, right? So when you have a hangover, what's going on when you have a hangover, right? Your body's in withdrawal. You feel like shit, right? Because the alcohol is washing out. Your brain, your body, your heart, everything, it's kind of, as it washes that alcohol out, it's kind of going withdrawal. So that sympathetic response you see when you have a blood pressure spike, heart rate elevation, that's all kind of as your body is getting over that, most commonly the time, even 2 days after sometimes, where you'll get the holiday heart syndrome. Wow. It's when you're getting that rebound. Exactly right.
That's for all our college students out there. Make sure y'all drink safely out there, right? So
that doesn't mean you're supposed to have a drink the next day. That just means that drink less. Okay?
The eye opener. That's funny.
Yeah, drink less.
So, Doc, did you hear about the global burden of disease study? So they analyzed like levels of alcohol use in over 195 countries from 1990 to 2016, right?
Yeah, okay, I know what you're talking about. Yeah.
Okay, yeah. And I wanted to ask you about the credibility of it, right? Because they basically concluded doing a risk versus benefits analysis that no amount of alcohol was safe. And the study's authors, basically what they said is due to their potential of increasing the risk of cancer and over 200 different diseases, plus driving accidents and self-harm, there's more risk than there are benefits due to alcohol consumption. So they actually came to this conclusion. What are your thoughts about that?
It's always hard to kind of make conclusions on these kind of studies where, they're registry-based studies using questionnaires. They're following these patients. You can't control for everything, right? And oftentimes, especially when it comes to alcohol, and when they're going by reported alcohol use, people are always going to downplay it, right? So when you think that, even these people who drank 3 drinks a week, they did bad, but how do we really know, right? True. So it's I think it has to be taken with a grain of salt because obviously it can cause a lot of problems, as you mentioned, everything from vehicular accidents to health problems to all these kinds of things. So the therapeutic window is narrow. It's kind of classic with the patients too. You tell them, a little bit of alcohol may be all right, but they may, you give them an inch, they're going to take a mile, In all fairness, I haven't analyzed the study in depth, but my suspicion is you're going to find data, it's always like a back and forth, right? They say, first red wine's good for you. Oh, no alcohol is good for you. It's the same story with coffee, and we can talk about that too. I think at the end of the day, the key is, it's moderation, right? I mean, if you're going to drink alcohol, you got to drink it in a responsible way. You got to drink it in moderation. If you're going to drink it, they say 1 to 2 drinks a day, but then again, they classify, if you have more than 13 drinks a week, you're an alcoholic, right? Yeah. So it's got to be taken into perspective.
That said, in 2012, 3.3 million deaths, or 6% of all global deaths, were attributable to alcohol consumption. So drink wisely. Next, I wanted to transition into diet. There's many diets out there, Doc. There's a DASH diet, keto, paleo. People are going vegan left and right. So what do you recommend to your patients, and what would you say about this?
It's a huge topic right now. I mean, diets are huge. I mean, there's one fad diet, next fad diet. And I think in the world of internet, in social media, diets have become nuts. It's kind of like the data has kind of almost been forgotten. There's data-driven stuff, and then there's just like some famous person says, "Oh, dude, this thing is gonna do this," and then it catches on. Things just become viral, So I always tell people you got to take it with caution. There is diets that sound good, variations on the same type of diet, but at the end of the day, and we can chat about it. There's not that much great data on a lot of diets, right? There's anecdotal stuff. There's small studies. So I just caution people that always remember, despite what you read, just because someone says, oh, there was a data-driven trial on this, if it's 45 patients someone's following, it doesn't mean that necessarily proves anything. Another thing about diets, every disease, every specialty may have a different diet that's beneficial to that particular disease state, right? So, and again, to be fair, I'm not a trained nutritionist. I don't pretend to be. I'm sure you people out there who know a lot more than me. So, I will try to answer and give you my kind of sense based on what I know in my training, right? So, what do I recommend to my patients? I mean, the two most recommended heart healthy diets out there are probably the DASH diet and the Mediterranean diet. they're very similar in what the recommendations are, right? And it's almost like common sense, right? So what you think would be heart healthy is likely what these heart healthy diets recommend. So both of them are heavy on the plant-based, right? I mean, even though these aren't pure plant-based vegetarian diets, they rely heavily on increase of whole grains, plant-based foods with a much lower consumption of fatty meats, saturated fat containing animal fat related products. I would say the Mediterranean diet is it's more of a guideline than a diet. A DASH diet kind of dictates, okay, X number of portions of whole grains a day, this many portions of fish a week, this many portions of low-fat dairy, kind of lays it out. Whereas the Mediterranean diet is more of a guideline, right? It's kind of this pyramid we think about, where, the bottom of the pyramid being the broadest point of it, it's all the fruits, the vegetables, the legumes, and all those kind of heavy in the plant-based realm. And the higher you go, the lower the the amount is. For example, the very top of the Mediterranean diet is red meat, which they only recommend a couple of times a week. And the biggest sources of protein are actually fish. It relies on getting its fat content from healthy unsaturated fat content, such as certain types of nuts and olive oil. Whereas the saturated fats, the trans fats, things with red meat and even the fatty parts of poultry and all these other kinds of meats, that's thought to be the unhealthier things, right? DASH diet, similar again. It's a little bit more lenient in the amount of how much lean red meat you can eat. It's more lenient in its dairy. It's more of a balanced kind of diet. And again, it's for all comers. They're kind of easier to adapt to, right? Versus, of course, I got guys coming in, I'm eating a steak every day kind of thing, right? Yeah. So, all right, dude, you can't do that, but I'm not going to tell someone like that to say, you know what, you got to go vegan. It's not realistic, The Mediterranean diet, we actually have good data for it, and the DASH diet as well. And the Mediterranean diet, recently we had a trial come out that actually showed when they randomized patients to Mediterranean diet versus a non-Mediterranean diet, they actually had a lower risk of heart attack and strokes and cardiovascular death. So it actually had a beneficial effect. I can't think of many diets, if any diets, that have a randomized trial with a large number of patients that showed that it actually had a positive impact on cardiovascular health. Is that because it's heavily plant-based? Is that because they're eating a lot of olive oil and healthy nuts? No one can say for sure, but that's the kind of the model that we can kind of promote to people. As far as vegetarian and vegan, big fad these days. Extrapolating from what we know about the Mediterranean diet, even partly the DASH diet, these are plant-heavy diets. So there is no doubt that a plant-based diet is heart healthy. We have studies, we've looked at numbers where people who've gone from, regular kind of omnivores to plant-based, their cholesterol is plummeted. We know these people have said that, the LDL cholesterols can be in the 150s, 160s and come down to the 80s and 90s with a heavy plant-based diet. People try feeling better. It is difficult to follow, especially like a pure vegan. Like, I don't know, I can't tell you anything about vegan versus vegetarian. I don't think we even have that data. The bottom line is, it's tough sometimes for people. It depends on your population, right? I think vegetarian diets can also be detrimental. You can't just say, okay, I'm giving up meat and eat French fries every day, right? Yeah. And, people do that. Oh, you eat pizza and French fries. Is that healthy? No, it's not healthy. It's worse than eating meat. So it's got to be taken into perspective. Just because you're not eating meat does not mean you're not going to be eating unhealthy saturated fats, trans fats, and things like that. Take a step back. The core of these healthy diets we talk about, the Mediterranean diet, the DASH diet, these vegetarian diets, it is plant heavy. It's reducing the amount of saturated animal fats. I'm going to add another thing. There is a lot of clout out there. Internet cult stuff talking about how vegan and vegetarian diet and some even these people pushing a lot of supplements sometimes that, my plant-based diet will reverse heart disease. Need medications when you are on my diet, So that's when things get a little over the top. But there are people who are claiming, a plant-based diet can reverse heart disease. And I have patients who come into me and who've had heart attacks and they say, I don't want to take a statin drug, which is the most studied and effective drug in heart disease, because I'm going to go on a plant-based diet and I'm going to reverse my heart disease. So there's a limit where things get a little overboard. Things are healthy, but making these kind of claims, I think, can be potentially dangerous at the same time. So we all have to be careful on, how we approach things and what our data sources are.
So what are your thoughts about intermittent fasting?
I don't think we have enough data to say how does intermittent fasting actually affect heart disease, right? We don't. And I've looked it up before, and we don't have much data. We know that it is effective for weight loss. So what is intermittent fasting? So we're basically talking about dietary plans that are kind of I like to think of it as kind of following your circadian rhythm. You're eating for a period of 8 hours or 10 hours, whatever it is, 7 a.m. to 4 p.m. You're going to have your meals throughout that day. And then after that, you're going to fast yourself till the next morning. And what is that doing? It's the essential metabolic basis of that is you're trying to decrease your body's insulin levels. So when you're not eating, your insulin levels are going down, all right, because you don't have food stuff that you're kind of breaking down to metabolize. So you go to your fat stores, right? Your body uses the fat stores and uses that to produce energy. And that will occur when you have a long period of time when you're not eating. So, that means you can't be snacking, you can't be doing this and that if you want to do true intermittent fasting. And that's effective at weight loss. It's proven to be effective for some metabolic disorders, some, people with diabetes and whatnot.
That's right.
Certainly pre-diabetics, metabolic syndrome people, that can be very healthy. Does that translate into less heart attack, strokes? I don't know. We have data on rats. There's rat data that show that there's reduced cholesterol, reduced diabetes, and heart attacks, but, we ain't no rats. So, unless we have more data on humans, I can't tell you that it's necessarily going to be beneficial to the heart. But look, if that diet helps you lose weight, all the power to you, And I always tell people when it comes to diet, talk to a nutritionist, learn about it. Don't just read some wacky internet site.
So am I correct in assuming that your growth hormone levels are way higher when you're fasting? I've heard that insulin and growth hormone, they work in opposite. So basically, when you're intermittent fasting and you decrease those insulin levels, your growth hormone levels are higher, and it can help you actually pack on more muscle. Because I know a lot of athletes, and a lot of them intermittent fast, and they're freaking ripped year round. It used to be bulk in the winter, shred in the summer, but now it's just shredded year round intermittent fast. So is that a correct assumption to make?
Again, I'm far from an expert in fitness and diet, but yes, you are correct that I think those you're kind of taking advantage of your body's natural hormonal responses and negative feedback receptors. And yes, so as the insulin goes down, your growth hormone goes up. So you're exactly right. People who work out and people who are athletes, they take advantage of that, and it works. People lose the weight and they can change a little bit enough of that metabolic homeostasis in your body to promote that muscle growth and reduce those fat stores. Does that reduce future health benefits? I don't know the answer to that, but what you say is correct. Yeah.
So I intermittent fast. I've been doing it for some time, and I recognize how
do you do it? What is your thing?
I usually fast for at least 12 to 14 hours, right? So after I have dinner, I just make sure for 12, 14 hours, I just don't put anything in my body. And then after that, I'm mainly greens. I eat a lot of greens in the morning, a lot of fruits. I don't eat like heavy meals until later in the day. I just have more focus that way. But then in between that window, I'll get my protein. So I'll have my eggs, I'll have my salmon, I'll have steak every now and then. Like you said, as long as I'm getting more greens, I felt like that was most beneficial. I noticed it takes about 8 to 12 hours to deplete those glycogen stores and to switch over to fat burning. And then when you replenish that and you go exercise, it takes about an hour of exercise to deplete those glycogen stores again. So technically, if you're intermittent fasting and you're exercising, it's possible to deplete those stores twice, right? Is this fact, or is this just kind of magical thinking?
I don't know the answer to that. I think what you're saying has probably been proven in terms of, when they're evaluating, numbers of patients are doing that and they're testing their, when they're doing blood tests and evaluating it. Is that responsible for that clinical benefit and that the benefit you get from the fasting? I don't know. But, metabolically, it makes sense, right? The cycle between insulin and glycogen stores and fat and all that stuff, you're taking advantage of it, right? Outside the realm of what we grew up thinking, okay, this is the way to eat. This is what we're supposed to do. But is it really? Maybe if you're looking at metabolically and on how to keep lean and how to keep balanced, maybe this is the right way to do it, right? That's an interesting thought, rather than just 3 meals a day.
So yeah, I've read the anecdote where they're like, we used to be hunters and gatherers. And when we were hunting and gathering, there were times where we go days without eating. But technically, when you fast, when I fast, my mind gets really clear after like 2 or 3 days. They said the evolutionary adaptation that happens there is when we are in a state of ketosis and our brain switches over to using ketones rather than glucose for energy. It clears our mind, and it may have made us better hunters when we were hungry. It helped us survive. That was the evolutionary theory. Mm-hmm. Have you heard anything of that? Is that?
Well, you can extrapolate, right? Ketosis. So, when we're talking about the ketone diet, for example, right? That's what we're doing, increasing the number of ketones that are circulating. And we know that ketosis and ketones has an effect on the CNS. For example, a ketone diet, that has been proven to have beneficial effects for people with seizure disorders and CNS effects. So there is definitely a proven link that causes some effect within the CNS. So that may be completely true because there is some connection there. When you're talking about and fasting in that window where especially our bodies and we're not used to that, right? But when things kind of settle down, you get past that kind of almost like a withdrawal period, right? And then you're going to get into that period where oh, you know what? This may be the moment of clarity where oh, this is good.
We had Michael Jordan and Kobe Bryant's trainer on our podcast, and he talked about how he makes his players instantly. They have to start fasting, and for the first 3-4 days, they just have headaches, and they're just they're screwed up. But then it's followed by clarity, and he's one of the greatest mind-body coaches. He makes the greatest athletes do that, right? So it's just so fascinating to talk about. I could talk about it for days. It's just such an interesting concept. So I wanted to turn the page here and discuss the connection between mental health and heart health. Most of us, we're aware that our state of mind, it affects our body. So I know when I'm angry or when I'm stressed, my heart rate rises. I know when I'm relaxed or calm, my heart rate lowers, right? So how does the state of mind affect the heart?
If you're in medicine, you know that the CNS is connected to the heart, right? What is the heart innervated with? Vagus nerve, sympathetic nerves, right? So that's how the fight and flight response occurs. That's how when you have stage fright, you're getting your heart palpitations. It's all about what you perceive, what you see, what you hear. That's going to have an equal response out to the rest of your organs, especially to your heart, right? So we talk about this mind-body connection, but that's a real deal thing. When you have these kind of acute effects, your heart rate could go up, your heart rate could go down, right? You could feel sensations in your chest and heart, depending on what the situation is. And, that could be something as simple as hearing bad news or, standing up for a speech and getting stage fright. But it can be as extreme as causing a severe negative effect on the heart itself. There's a wide range of effects in the acute phase that can occur from the state of mind to what's going on in your heart. For example, stress, how it can lead to pathological problems, right?
Yeah.
You've heard of the infamous Takotsubo cardiomyopathy, I'm sure.
Heartbreak syndrome, right?
A broken heart syndrome, that's right.
Yeah.
That's right. Yep, the broken heart syndrome. So I still find this to be a fascinating thing. And, when we talk about mind and body, this is kind of proof in the pudding how, mind really is connected to the body and can actually cause, serious problems just by what's going on in someone's head, right? And not just beyond just simple depression. We're talking serious effects on organs. This unique disorder is when someone has severe emotional stress. We talk about it, we call it a broken heart syndrome because it's most commonly occurring in the setting of a death of a family member or some severe emotional stress in that same kind of realm. And what happens is somebody comes into the hospital basically mimicking the STEMI. So they'll come in with severe chest pain and everything on paper with what they say, how they look, and what their EKG shows, you suspect they're having a massive heart attack. And then when we go in there and we take a look at their heart and arteries, we see that their arteries are clean, but we see their heart muscle is stunned and weakened. Right, okay. So you have this heart muscle weakness that is pretty much indistinguishable from a large anterior wall heart attack. Self-limiting, usually this will get better. I mean, there are some cases where people can get very sick from that. Basically identical to a large heart attack in some ways, all caused by just what someone is thinking. This has only been really identified and discovered in the last 15 years. Before that, we probably had this happen all the time. We didn't even know it. Yeah. But I mean, there's no greater mind-body evidence connection to me than that syndrome. I mean, it's fascinating.
In 2006, the American Heart Association, they incorporated this disease under the class of acquired cardiomyopathy. So it's a real thing, which is pretty insane.
It's in the coding ICD-10 coding criteria when I use it whenever it was before, and it's actually more common than people think. I see it all the time. That's a perfect example of, in acute phase, how someone who's completely normal 1 second, but then has some, mental or emotional event in their mind that can cause an acute effect on the heart.
Perfect, because that goes into how perception of stress influences our physiology. I've done multiple posts on this on MEDspiration. There was some studies published in Harvard that, basically say the key isn't to deny stress, but it's to recognize and acknowledge it. When we're able to do that and find the upside with something that's stressing us out, there's basically one of two things that can happen, right? So individuals who have a more stress hardy mindset, who are basically able to say, I think stress is advantageous for me. I think it allows me to be more efficient under pressure. It gives me a sense of urgency, and I have a stronger work ethic because of it. Basically, what they found is the stress response that happens, the heart rate rises. It's more similar to the effects of exercise, where it allows for maximum blood flow. But then there's the negative mindset where people who think of stress as something that sucks, it's the end of me, man, every time I get stressed out, horrible things happen. And they basically said that goes into constricting the blood vessels, ramping up inflammation. And that's a question I'd like to pose to you. Is this a thing, or what do you think?
I've heard of this peripherally, and I read about it. I can't say that I can answer that question. It seems to me a lot of it is how you're perceiving the stress and acting on it, right? So what you're describing is this: you have a stressor. So you take two different people, maybe even the same stress. Are you going to use that to put you down, or are you going to use that to your advantage? I'm, for example, if I have a presentation due, I know until the night before I'm useless. And then the night before I'm on my A game, I'm like, oh, I got to get this done. Motivates me. Whereas, some people are like, oh God, they're defeated. It's not going to work. So, it's kind of like how you're going to take a stressor and what your mindset. I wonder if situations like that, you can train people to kind of, if someone who's not taking stress very well, get some MEDspiration in your life, and rather than making it a negative thing, which is a big problem, right? Stress in America, I spent a whole podcast talking about that, the negative effects of stress, but maybe, as you pointed out, maybe we can find a way that people turn it around,
That connection, the mind-heart connection, it's so fascinating just to think what our potential can be, that's something that it drives me every day to love medicine more and more, So.
I'm telling you, man, it's real. And, just to finish on that note, it's people who have had heart attacks, who have heart disease, they have a much higher incidence of depression that goes untreated. And people with depression, actually, that's thought to be a risk factor for heart disease. So depression can have negative effects, not just in the acute stress-related phase, but long-term, it can almost be like a chronic disease.
It's actually Heart Month right now, right? And you started a pretty big movement on Instagram, and I really appreciated it because my dad actually just had a cabbage. Okay. His case was just miraculous, because he had collateral circulation, so he actually had 100% occlusion of his left circumflex, but he had collateral circulation that worked around it. He never had an MI. So right. I was looking at it. I'm like, Dad, this is stable angina. We'll take you to an interventional cardiologist. We'll have that stent put in. It'll be no problem. Pretty non-invasive. Ends up, he needs a cabbage, man. And, this is, you started this movement, and it was actually right around the time that happened, right? So you were talking about South Asians and heart disease, right? So can you give us some facts just about heart disease and South Asians and heart disease?
Me and Clear Skin Doc on Instagram, we both started this together, so I'll give her a shout out. South Asians, being South Asian myself, you're South Asian, I had treated a lot of South Asians in my training in New York as well. I felt like people who are Indian, Pakistani, Guyanese, all these South Asian, they just come in at a much younger age, and they have heart attacks and stents and stuff. Even in their more in their 40s and 30s, 40s, 50s, even people. I've even had people in their 30s having this stuff. So as my training progressed, I'm like, you see it more and more. And then when you look into the data and you look at the numbers and the statistics, it's true. We as South Asians, we get heart disease at a much younger age. Our incidence of heart disease is higher, and this is women and men. Chances of it being more advanced and more severe are also higher, and the mortality from having a heart attack is also higher. But the biggest thing is, it seems that the heart disease is occurring at a much younger age. A lot of people will point to diet and lifestyle, and I'm sure that's a big part of it. And we all know Desi food, the food we eat, our parents cook, we go to our homeland. It tastes damn good, man. It may not be the healthiest, That being said, that's not the only feature. They're pretty healthy eating vegetarian Desi people as well, or South Asian people who get heart disease at a much younger age. They've done calcium scoring studies where they do CAT scans to look at people's hearts, to look at the amount of calciums build up in the arteries. And they saw those numbers were a lot higher for South Asians as well at a younger age. And our cholesterol profiles are different. All the data we have largely comes from America and Europe. and they're looking at risk factors, smaller minority of African Americans, but very few South Asians, right?
Yeah.
So all these lipid numbers and the risk factors and profiles, it's not really coming from our people. And we know that we're distinctly a little bit different metabolically. Our cholesterol profiles are totally different. We often don't have very high LDLs, but we have very low HDLs, which is a risk factor. I think there's a genetic predisposition to South Asians having, earlier onset of coronary disease. There's some genes floating around in our pool that, puts us at a higher risk for heart disease. And on top of that, we also happen to be the least active and relatively unhealthy eaters. And this is true. This data from Fitbit. So Fitbit collects all this data. I thought this was fascinating from all these countries, millions of people, and they plotted number of steps and activity per day. The worst were Pakistan and India.
I knew it. I knew you were going to say that.
The least active per day. We get more heart disease at a younger age. We don't do anything, So I was like, we got to start telling our friends and family, aunties and uncles, we got to start spreading some more health awareness. I think it comes down to education, man.
It's funny because it's like the doctor or the engineer or the lawyer is mostly sitting on their butt.
When did our parents ever say, go for a run? Maybe that's why the Fitbit data is so bad, because all these dudes in Pakistan and India are starting to be doctors to come to America. They're just busy studying.
We're talking about mental health. I know in the brown community, man, at least from my experience, they don't believe in mental health. They don't think that addressing their problems is like a thing. But then I feel like all that stuff they just keep inside, it adds to that stress, and then it causes stuff like this.
I'm glad you brought that up, and you're totally trying. It's almost like a stigma in our communities. It's like, depression, no, you don't do that. They would never admit it, God forbid. And my wife's a psychiatrist. Some of our family members, they don't even believe in that. It's like, what is anxiety, depression? I don't understand this nonsense. It's like a cultural thing, and you're right. I think that's probably negatively contributing because no one's seeking help or attention, or they're too scared to, and it's almost not even identified. I think that's probably a big part of it,
Yeah, I've started having exercises in my family. Like I have family meetings. I'm like, everybody sit down, like, especially the men in the house. We need to talk about how we feel, and like, we need to communicate because, the men just keep it inside, and then, they have heart disease all of a sudden.
Yeah. So, and they will never, they'll just be stoic, and they won't talk about that stuff, and they won't exercise.
Weakness. Yeah.
The stats that I gave you, our numbers are bad and high, but clearly we've just identified so many ways that we can impact that, right? Diet, lifestyle, mental health, exercise. I mean, that's huge, right? I mean, those things are big. Numbers may be poor, but there's clearly a lot of ways that we can intervene. We just got to get them on the page, man.
And a Fitbit. I'm about to get one after this. I'd like to transition to our last and most popular portion of our podcast. That's the audience questions. So I was telling you earlier today, you actually had the second most question submissions on the MEDspiration podcast history. So, we had to add some bonus questions in there. So I think people are really looking forward to hearing the answers to this, right?
I'll do my best.
Okay. Well, let's get straight into it. So question number 1 was by Deegs07. This is actually my friend Diego. I went to high school with him. So
is that right?
Shout out to Diego. He asked, what are the physiological differences between fasting daily versus 1 24-hour fast 1 day a week?
Good question. I don't know if I can answer that. I got to be honest with you. To get the benefit of intermittent fasting, I think you have to have a period of time that's at least 8 hours, 8 to 10 hours to get that benefit of what you're getting out of it. Whether pushing that to 24 hours, I don't really know if, is there a point where you can actually cause, maybe some negative effects? Whether there's an actual benefit physiologically going to 24 hours, I don't know, and I don't think so. But can it accelerate your goals of, fat burning and all that stuff? That may be true, but that's just my gestalt and guess.
So we have question number 2 by HWA Pod 06. Okay. They said, is it true that running too much is bad for your heart?
It's actually a very good question. We always recommend exercise, right? So, the American Heart Association recommends at least a minimum of 30 minutes a day, 5 days a week, of at least brisk walking that will break a sweat, okay? For most people can't do very heavy exercise. A lot of people can't, so that's what you want. But at the same time, too much exercise you can get. Now, we know this from marathon runners. They've done studies where, they looked at marathon runners and they've done troponin values on marathon runners at the end of long marathons. And a lot of marathon runners, you see troponin values that are a little bit elevated. There are people who are highly trained, but there are people who are doing a lot of running who may not be, as trained. I personally think, marathon running is, it's a different breed of people. But when you're getting to that level, it can be deleterious. And I have patients who are big time runners and they've dropped dead of heart attacks. And we know if you overdo it, you can increase the risk of having heart attack and strokes, particularly depending on individual people's conditioning and situations like that.
Just my question personally, what's a heart rate that you would want to aim for when you're exercising? Because I'm always looking at my heart rate when I'm doing the stair stepper or when I'm running, right? So what's your recommendation when it comes to that?
Good question. I mean, it depends on what you're trying to achieve. To put it in one extreme, when we're doing a stress test on somebody, right, and we're trying to get max exercise capacity, max peak capacity, we're trying to get them to 80% of their predicted heart rate. So that's like the maximum level of aerobic capacity that we want to obtain when we're doing the stress test. So, it's really age related. Your quote maximum heart rate is 220 minus your age. If you want to train at a high level, 60 to 80% of that max heart rate is kind of a goal if you're really trying to train. But honestly, if you get your heart rate, depending on where your age is, even to the 120, 130s, that's something. Not everybody needs to get their heart rate to the 160s. You don't need to, if you do 220 minus your age, that's your max heart rate. You don't need to get anywhere near that. If you get, up to 80% of that, that's all you need, bro.
So we got question number 3 by Dr._Himradi_Vakaria. Sorry if I butchered that name. What can you tell us about dairy and heart health?
Dairy and heart health. Also a very controversial and hotly debated topic, And over the years, dairy gets a bad rap, it gets a good rap, Again, another perfect example of we don't really have enough data and trials to be definitive. A lot of it's just kind of anecdotes of what people think based on what's in dairy. So, but I will say, for example, the DASH diet we talked about, dairy is included in the DASH diet, right? So low-fat dairy, because dairy has a lot of good stuff too, right? Potassium, calcium, magnesium. It's got important things that will help blood pressure and help heart health. But on the downside, full-fat dairy stuff has saturated fats, right? So the thought is that too much full-fat dairy will have higher saturated fats, which will in turn increase your bad cholesterol, which can cause deleterious effects. But on the other hand, if you do non-fat dairy, that will have less of those healthier mineral stuff. Now, there's some diets that completely limit dairy. They say that it's no good. But there's been some meta-analyses, interestingly, that looked at looking at multiple trials, and it showed that dairy, people who eat in full-fat dairy versus those who don't or eat no dairy, there was no difference in the amount of heart disease. And in some cases, in some trials, they saw that, in some people who eat full-fat dairy, there was even less heart disease. So I think the bottom line is we don't really know the answer to that. I'm more of a full balance guy. I think it's important to have some dairy, keep it in the low-fat dairy. Aside, this doesn't mean you're going to be going out and eating cheese every day. Butter, and obviously butter is a different story because that doesn't count as, quote, dairy, guys. So yeah, the verdict is, it's unclear.
Question number 4 is actually a question I would ask as well. So show_banana asks, what are your thoughts on pre-workout supplements? Which is something that I'm very interested in learning more about. I haven't done any research about it. But then she also says, especially if you have a known cardiac issue. So what do you got for us?
I'm never a big fan of supplements, at least when it comes to cardiac disease, because to me, the supplement market is huge. It's a money-making machine. You got to be careful with supplements because they don't have the standards, right? FDA does not label the medication, so it's not regulated. Any supplement can be thrown out there with little to no data. Most of the time, people don't really know what they're taking, right? Anything you take in a supplement, you can get with diet, for the most part, right? Supplement is a broad term, so it really would define what people are talking about. A protein shake to increase your protein intake, this and that is different. But, taking supplement and tablets and these fat burners and these muscle-building energy stuff, there's evidence that they can cause deleterious effects, especially cardiac-wise, over time. So my cardiac patients, I tell them I don't want you taking any supplements. But even younger people who are trying to use this for fat burning, muscle building, whatnot, you got to be really careful out there.
We did a MEDspired Army post recently. One of my friends, Austin, from high school, he was taking ephedra, which was like a fat burner, and he ended up having congestive heart failure at 30. And now he had an LVAD place, and he's looking for a heart transplant because of the stuff that was in it.
There are case reports of ephedra, which is in a lot of these supplements by fat burners, that can lead to cardiomyopathy. Similar to what we talked about with the cocaine and alcohol and all that. The right person, the wrong person, a supplement or a medication, how is that different, right?
Yeah, he's doing well right now, so we'll definitely follow up with him, because just seeing that at 30, you're like, dude, like that was So
But
young, and he looked like he was in great shape. So that's one of the worst things about these supplements is when
perfect
you're
example, man.
exercising on them, you look better. So you
Yeah.
think physically I look better, you think internally I'm gonna look better. But a lot of these supplements, they give you that physical, but then internally they're doing the opposite.
Chewing
right?
you up. Yeah, and they're not FDA regulated, right? So any Joe Schmo can throw them out there, make money off you.
Ask your doctor. Anybody out there who's trying to use a supplement, come to your doctor, bring the supplement to your doctor.
Bring it with them,
Make
exactly
sure
right.
It's never going to hurt to do so. Question number 5, Malls11 asks, what advice do you have for a first-year med student interested in cardiology?
A good question. Number 1, get ready for a long road. My one advice for you is, whether it's cardiology or anything, make sure it's something that you love and you really want to do. You got to like what you do, because it's dedication. It's going to take a lot of time out of your life, and it's going to affect how your life course is, even your personal life. So it's a lot of sacrifice. So number 1, you got to really want to do it. As far as cardiology goes, it's one of the more competitive fields, obviously. Never hurts to start early. And, when you're applying for residency, then after that fellowship, is study your ass off. Okay?
Get that 250.
Get that 250. I mean, I hate to say it, but step 1's probably the most important thing. Crush that step 1, bro. I mean, that's so important. Not that if you don't, you can, there's other stuff, but it's just going to make life so much easier.
All right. So question number 6, Med Student 4 asks, how many hours do you typically work? How many calls? And what's a typical day in the life?
Great question. Now, keep in mind, this will vary by the type of practice you're in, right? I mean, I could give you an example. I'm going to give you an example of what I do, then I'm going to give you an example of what one of my friends does, for example, right? So as an interventional cardiologist, again, and I do a little bit of both, right? I do procedures and I do regular cardiology. So for me, I spend 2.5 to 3 days in the office, and then I'm on 2 to 2.5 days in the hospital. That's my 5-day week. Excluding calls, so days that I'm not on call, if I combine and kind of average things out, of course, there's longer days and less days. I would say I probably get there around 7:38, and I'm usually done by 4:35 on an office day, which is not bad. There'll be some days I'm there till like 6, but it's rare I'm there super late. Hospital days, get there at 7:30. Usually I'm done by 5:36, but there's some days I'm there later till 7:30 or 8. But I would say averaging out, I'll probably work between 40 to 50 hours a week. There are days weeks I'm on call, I may be in the hospital, 50 to 60 in bad days. But, there are nice smooth sailing weeks where I've had times where I had a 40, 45 hour work week, man. Call is a big thing. You always think about how often I'm working the weekends. I got pretty lucky. I work one every 6 weekends, so it's not that bad. And when I'm around on the weekend, I go to 3 different hospitals. But usually if I got to see 20 to 30 patients, I can go in the morning and I can be done by the afternoon. Of course, when I'm doing angioplasty interventional call, all bets are off. That's not as often. I'm one every 12 weekends, and I can get crushed. Just to compare you to a friend of mine who took a job in New York that I thought about taking, but I didn't, that's why I moved out of New York, wanted to stay in New York, but, I wanted a quality of life. He works probably, 60 hours a week. That's like a normal week for him. And on weekends, he's probably working from 7 a.m. to 11 p.m. every day of the weekend when he's working every 3 weekends. And a lot of it will depend on, what type of practice and where you're going to be.
I appreciate that advice. I'm just about to find out where I'm matching in March. So,
What are you applying for?
Internal or family. Those are the two that I applied into, right?
Excellent.
So
good luck, man. I'm sure you get back somewhere good,
Yeah, wish me luck, man. That's it's nice to see you on the other side. You paid your dues, and now it's like, hearing 40, 50-hour work week, I mean, for what you chose, that's beautiful, So
that's not bad. I mean, look, a couple of days I work hard, the other days, as long as it's not every day, it's the choice I made and the practice I'm in, and, they're options. So you got to remember, wherever you choose in medicine, think about what is the field you want, but what's important to you? Is geography important to you? Is it important where you are? Is salary important to you? If you want to be in New York City and you want to have a quality of life and you want to make X amount of money, you're not going to get all that. Or you want to be in San Francisco and have all that. But if you're willing to sacrifice where you are because you want to do this field, if you're, you don't really care about how many years you're going to practice and loans you rack up, and you want, is it lifestyle, is it salary, all these So you gotta think about all these things. You're never gonna have everything you want.
So last question, what is your definition of MEDspiration?
I see how you took medicine inspiration, but the letters and the words in there, it melds more than just mind and body, I think. I know you're going through the mind and body connection thing, and even, I learned a few things just having our conversation. You got to take everything part of it. So ME, the first word's me, right? Me is important. That's part of it. Then for me is medicine. We're all medicine, at least in the medicine angle, so that's important. You got to think about anatomic. You got to think of the medicine portion of it. Then the spiration portion, it's got spirit in it, it's got inspiration in it, it's got mind in it, right? So it's a perfect example, I think, of how all those things are well connected. Some people are over they're just very spiritual. They don't believe in X, Y, and Z, and they think meditation will cure everything. But then they're very kind of other-minded people, like, science, anatomic, this and that. But you know what? I think the combination of those things is what's going to make people a good doctor, a good patient, and a good person. And you got to have a better understanding of what you can see and understand and what you can't.
Yeah, our big philosophy is mind, body, spirit. It's all about having that balance. So thank you. That's such a deep interpretation.
I went deep on that one, but
Yeah, I appreciate it. Well, thank you, Dr. Haider. We appreciate having you on, man.
No, man. Thank you for having me, man. I had a good time talking to you, bro.
There you have it, folks. I hope you guys left this one feeling medspired. If you learned something new, or if you genuinely enjoyed this episode, please don't forget to subscribe to our podcast and rate it 5 stars. MEDspiration is a 501c3 nonprofit charity organization. The more you help us grow, the more people we're able to help. For example, our newest sponsorship with Picmonic is currently helping us fund our ongoing work at a small children's school in Cambodia. If you're currently a future healthcare professional and are studying tons, don't forget to check out Picmonic's learning tools for free. You can use the discount code MEDspiration for 20% off any membership. Please visit Picmonic.com for more. We'll be sure to leave a link in the description below. Let's make a commitment together, guys, and attempt to live a healthier lifestyle, mentally, physically, and spiritually. And as always, you know what time it is. It's time to get out there and do something med-spiring.